A very good morning, my all dear kids. So, as you know, that we have started with our lecture, with our chapter that is reproductive health, right? Chapter number 4. And here, in my previous lecture, I gave you few basic idea that what are we going to read in this chapter, as well as we discuss some values. Bacha, there was one value which I wrote by mistake. That was I wrote there million. So you can correct and you can correlate and check those values again and then make them correct, right? So I told you that the census conducted in every 10 years, right? And we specially said that the first census was held in 1871, right? So in the 1900, so that is why this time I made a difference, because you were getting confused between the normal population and the world population. But in 1900 the world population was 2 billion, in 2000 it was 6 billion, and in 2001 it was 7 billion. In 2011 also the population which was observed according to the 15th census, that was 7 billion. So don't get confused with the year 2001 and 2011. Approximately the population that came out after the census, that was the in the billions. And when the 2011 census was held, it was said that the out of 7 billion, 1.2 billion Indian population that was reported. So that time we realized that the population is exploding in the India. Most populated state is our UP, and the least populated state is Sikkim, right? So this don't get confused with these values. These are the exactly same values I have taken from the NCRT. In 2011 it was 7 billion, and in 1900 the world population was 2 billion. First census was held in 1871, right? So this is about the previous lecture. Now in this particular today's lecture, we are going to talk about methods of contraception, because we know that if in any area when the population explode, it means we are not controlling the birth, right? We are not paying the attention on the birth control. So there are the different methods of birth control. There are the different methods to prevent pregnancy that we are going to discuss, bacho, in this particular lecture, right? So our today's topic will be so please take a very comfortable seat, sit on your study table, get ready with your pencil and your notebook, so that you can make your notes your own by listening to me, right? It will definitely, when you write something, that definitely affect it, that things somewhere they goes in your mind also, rather than just listening to the things. So I always prefer, whenever you listening to my videos, your notes should be also ready with that time. So let's talk about our today's topic, that is the methods of contraception. When we say methods of contraception, every one of you, when you are listening to me, you are in your mind, the word contraception should be crystal clear, right? Contraception means prevention of pregnancy, and the methods which we use to prevent the pregnancy, they are known as contraceptives. I think this is clear, that what we are going to discuss, that we are going to discuss different methods, that how you can prevent when when a person's family is complete, it already has 2 kids. Now definitely you don't want more kids. How you can prevent pregnancy, or if any couple that wants to take a break, doesn't want to have a child at that time, that how different methods helpful to prevent the pregnancy. So methods which we use, they are known as contraceptives, right? Now when we say contraceptives, what is the thing which comes in our mind, that which kind of contraceptive should we use? Whenever we say this word, that which kind of contraceptive we should use, every person wants to use that thing which could be easily available. So an ideal contraceptive is the one which is easily available, right? That is the always the first priority of a person, that it should be easily available. Second, if a person is using it, it should be properly effective. There should be no side effects, right? It should be had no side effects. Secondly, it should be temporarily, because if it will be permanent, suppose in the future if any couple wants a child, it wants to reproduce, then it should not be like that कि person cannot हैव अ बेबी, ऐसा कोई कॉन्ट्रासेप्टिव नहीं चाहिए. सो what is the main points about the ideal contraceptive? It should be easily available, it should be properly effective, and it should be reversible, means once you stop using it, you can the couple can be pregnant, or the lady can be pregnant, or the couple can have baby. So it should be reversible with no side effects, right? So that are the main points that which are needed when you start using a contraceptive. Now let's talk about the methods of very commonly used methods of contraception. The first method we are taking is the natural, and sometimes it is also known as traditional contraceptive method, right? It is a natural method actually, and this includes, first is the periodic abstinence. Periodic abstinence. Absent something, right? Now, in our previous chapter, we just finished our chapter that is called your reproduction, right? Human reproduction. In human reproduction, we completely discussed our cycle, which is known as menstrual cycle, right? And in menstrual cycle, we know that on 14th or 15th day, there is the chances when egg is produced, right? So in natural method, periodic abstinence means you should avoid, a couple should avoid fertilization or ovulation period, means that couple should have knowledge that when is the ovulation period, and on those days or between those days, means 14th to 17th day of menstrual cycle, there should be no sperm ejaculation in the vagina, right? So there should be no sperm collection in the vagina, should be there between 14th and 17th day of menstrual cycle. Other days, they are considered as very safe period for the sexual intercourse or the coitus. Why? Because no egg will be available in the fallopian tube, and when there will be no egg in the fallopian tube, even the sperm ejaculation in the vagina, it will not harm, and the pregnancy will not occur. So natural method in the periodic abstinence means please avoid that period, means we want to say that avoid fertilization or avoid sperm ejaculation on between the period of 14th to 17th day of menstrual cycle, because these are the most important days when egg can be present in the fallopian tube. So if a couple doesn't want a baby but sperm is deposited in the vagina during these days, then definitely there can be chances of pregnancy. So these periods can be or should be avoided. Second method is avoid, basically avoid or abstain from the deposition of sperm into the vagina by withdrawal or coitus interruptum. Withdrawal or the coitus interruptum. Male partner should withdraw his penis from the vagina just before the ejaculation to avoid insemination. Right, that is the another method to avoid pregnancy. That whenever there is a time period, whenever there is a ovulation, one is the period should be that period should be safe period, means there should not be any sperm deposition during 14 to 17 day. Another method is male partner can withdraw his penis or it can avoid the release of sperm into the vagina. This is called coitus interruptum, or avoid the deposition of sperm into vagina. And how the deposition of sperm into vagina can be avoided? By the withdrawal of penis or coitus interruptum. The third very natural method is lactational amenorrhea. Lactational amenorrhea, see, actually during this time it is referred that there is no menstrual cycle, right? This time is said that there is no menstrual cycle during this time. When there is no menstrual cycle, definitely there will be no ovulation, no egg. So when there will be no egg, and if a couple that goes for sexual intercourse, there will be no chances of a fertilization. But the major point is there should be intense lactation after the parturition, means after the delivery of the baby. Lactation should be intense, there should be proper lactation, right? So that is the point which should be noticed. So there are three methods which we considered under the natural method, that is the periodic abstinence, avoid that period. Second, during that period avoid the deposition sperm. Second, avoid the sperm deposition into vagina by the coitus interruptum, by the withdrawal of penis. And the third is during the lactational days, intense lactational days, because that time there is no egg and there are very negligible chances of the fertilization. So these three are the subparts in the natural method of contraception, right? And in the lactational amenorrhea, doctors specially they say that only till the 6 months after parturition or delivery this kind of method is effective if you want to do not want to conceive a baby just after the delivery, right? So chances of conception almost nil, but that is also effective mostly only the till the 6 months, right? And that is why it is always said that during that time period sexual intercourse should be avoided. Now the next method is barrier method. First was the natural method, now in which you can use something. Barrier means you are going to use something, and various these days very common barrier methods they are available for both males as well as for the females. Two very common devices which are used, that are first is the condoms. And many people they have a they have a very confusion that condom is only condoms they are available only for the males. No, condoms are available for both males as well as females. That is the first barrier method, very effective method, which is very commonly used in case of both males and females. Second method which is very commonly used these days is cervical caps or diaphragms, right? cervical, this is, as you can see, I have given the picture also, this is male condom and this is the female condom. Now सर्वाइकल कैप्स और डायफ्राम, यहाँ बच्चे क्या गलती करके आते हैं, इट इज़ स्पेशली अवेलेबल ओनली एंड ओनली फॉर female, right? Cervical caps and diaphragm, they are not used by the males. Here the sperm and egg, they are not allowed to come in contact because they are physical barriers, right? These are the physical barriers. So here you can see that this is the cervical cap that is used by the females. So here if any sperm wants to enter, so they blocks the entry of sperm into the cervix. It blocks entry of sperm into cervix, and usually they are used with the kind of a gel which kill the sperm, that is known as spermicides. It is used with a jelly like structure. ये jelly like structure जो है इसके ऊपर अप्लाई करते हैं और उसके बाद cervix में डालते हैं, and this is fit basically very easily, it fit on the cervix and prevent the entry of sperm into the uterus. Same is very commonly used, like this is the diaphragm, right? The diaphragm is little bigger in the width, and same is the cervical cap. So these are the alternative methods, both can be used for the entry of the sperm. These are the barrier methods. Now the question which actually comes in mind after study this, कि एक बैरियर मेथड है और बैरियर मेथड का बेसिकली क्या यूज़ हो सकता है. जैसे मैंने पहला बैरियर मेथड आई टोल्ड यू, दैट इज़ द कॉन्डम्स. इट इज़ मेड अप ऑफ, इफ़ यू लुक एट द पिक्चर वेरी केयरफुली, इट इज़ मेड अप ऑफ अ थिन रबर latex like material, right? It is basically, it is used, it is a cover, it is used to cover penis in the males as well as vagina or cervix in case of females just before the coitus. It is a temporary barrier, temporary method, so that the egg and the sperm, they should not come in contact, right? So to prevent the semen to enter the reproductive tract of female. So that is the first use of using the barrier method. Condoms also protect when you like suppose you don't know much about your sexual partner, and there can be transmission of diseases also from one partner to other during the sexual intercourse, and these diseases are known as sexual transmitted diseases. So it is always better, if you want to avoid these kind of diseases, then there should be always protection which should be used, right? So condoms are the one of the barrier method which protect male and females from sexual transmitted diseases. I think this thing is correct. This thing is understood. Now the diaphragm cervical caps, they are also made of rubber, and they are used, always remember that should be known to you, that bache condoms, it can be used for both female and males, but diaphragms and cervical caps, they are used by the females. One good thing about these diaphragm and cervical caps, that is they are reusable. Not for the condoms, they are not reusable, but yes, diaphragm and cervical caps, they can be reused. Now then they are applied with basically spermicidal creams, jellies, foams. So when you use these barrier like diaphragm, cervical caps with the different jellies or creams, they increase the contraceptive efficiency, right? So these are the 5 uses I have given you, advantages, that what are the use of using these barrier methods, right? So first we discussed the natural methods, second we discussed the barrier methods, and third we are going to we are going to discuss third method, that is called IUDs. I for intra, U for uterine, D for devices, intrauterine devices. These are the devices or structures. Look at the name, intrauterine devices. So these are the devices or these are the structures which are implanted inside the uterus, and that you cannot do at the home. They are implanted by the doctors through the vagina. You need a very experienced doctor for this, that is to implant it carefully inside the uterus. That is also very commonly used by the females. These are only for the females. So diaphragms and cervical caps, they were also the barrier methods which were for the females. These are also specifically only for female. And the most common method here, which is it is the most common method which is these days used by the females. There are three categories of these intrauterine devices. One is non-medicated, one is copper releasing IUDs, and one is hormone releasing IUDs. So these are the some structures. Basically, when we say devices, these are some kind of structures which are put inside the uterus. So non-medicated IUDs, they are include LIPA loops, loop like structure. Copper releasing IUDs, they contain copper T, copper 7, multi-load 375, and look at their name. Copper T, copper 7, they release copper ions. Then there is third category also, hormone releasing IUDs, and very common one is LNG20 and Progestasert, right? These are the common intrauterine devices which are fitted inside the uterus by the doctors. Now, how do these IUDs prevent contraception? We said copper releasing IUDs like copper T, copper 7, multi-load 375. Why copper? Actually, copper ions, we know that one thing which is very important for the basically fertilization, that is the motility of sperm. The more the sperm will be motile, it will be better chance that it will reach to the female reproductive tract. So copper ions, when a female uses copper releasing IUDs, these copper ions, they reduce. What do they reduce? They reduce the main weapon of sperm, that is the sperm motility. And definitely if the sperm motility is reduced, there already only 100 are able to reach to the female reproductive tract. With their less motility, very negligible sperms, almost very less sperms will be able to reach. And if they will reach, they basically their fertilizing capacity is also reduced. So copper ions major work is to reduce the sperm motility, and it reduces fertilizing capacity of the sperm. So there are almost nil chances of the sperm to fertilize with the egg. Always copper ions, they increase the sperm death rate. They basically decrease the sperm number. So they increase the sperm mortality. बच्चे mortality means होता है death rate. Now there are second another kind of IUDs, that is hormone releasing. Hormone releasing, they make the uterus, because they are hormone binding, they increase basically progesterone, so they IUDs, they make the uterus unsuitable for the implantation. और अगर implantation ही नहीं हुआ है तो pregnancy definitely will not be there. IUD's main function is that they help to decrease the number of sperm, so they increase phagocytosis, engulfment, खाना जिसको बोलते हैं, engulfment of sperms within the uterus. खाना, phagocytosis होता है खा जाना. So IUDs, they increase phagocytosis within the uterus. So these points need to be take care in mind. And why they are ideal contraceptives for females? They are the special these days very commonly used methods by the female, because those who want to delay pregnancy, or those who want to keep gap between the two kids, between one kid and another kid, that is why these contraceptives are used by a couple. Now the another category, that is the fourth category of contraceptive, is oral contraceptives. नाम से ही पता चलता है. Oral contraceptives, they are also known as hormonal preparations, or they are also known as chemical methods. And they actually, when we say hormonal preparations, they usually include two major hormones, that is the progesterone and the estrogen. So these are the oral contraceptives. And oral contraceptives, we have spermicidal jelly, and actually this include oral as well as the chemical method. So spermicidal jelly, spermicidal, most common chemical used. It is used by the females, obviously, because it is a spermicidal jelly. Where the sperms are deposited, they are deposited in the vagina, so that is definitely used by the females. It includes the chemicals like lactic acid, potassium permanganate, and they are spermicidal, death of the sperm. They are used to kill sperm, and if there will be no sperm, definitely there will be no fertilization. Second chemical method include hormonal pills. They are also used by females. Most commonly used by females are combination pills. When you take tablets, and these combination pills, look at the name, combination pills, they use combination of two hormones. I told you in the initial is that the chemicals are usually, the hormones are progesterone and estrogen. So these pills, they include combination of two hormones, that is progesterone and estrogen, and this tablet is given date or day wise. And usually these pills, they are taken on the daily basis and for a period of 21 days. अब दिमाग में आता है कि कब start करना है. It is started after the 5th day of menstrual cycle, from the 5th day, because 1 to 5 days bleeding phase होता है. So after, from the 5th day to the last day of menstrual cycle, these pills, they are taken by the females. And these pills, they are combination pills, usually we use, that is a combination of two hormones, that is progesterone and estrogen. Why? What is the effectiveness of these tablets? They inhibit, we know that during the pregnancy or during the ovulation period, LH is at the maximum, and before that there is the increase in the secretion of FSH. So these tablets, they work like that. They inhibit the secretion of two major hormones in the ovulation time, that is the FSH and LH. So ovulation is stopped, implantation is stopped, as well as they do one another work, very important work. They change the quality of cervix, they change the environment of सर्विक्स, बेसिकली जो सर्विक्स म्यूकस है वो चेंज हो जाता है, एंड दिस डज नॉट अलाउ the entry of sperm. The most common pills available in the market are Maladi and Saheli. The difference between them is that सहेली इज़ अ नॉन स्टेरॉयडल कॉन्ट्रासेप्टिव. इसको प्लीज़ बोल्ड लेटर में मार्क करना आप लोग प्लीज़. सहेली इज़ नॉन स्टेरॉयडल. बच्चे स्टेरॉइड्स के बिना, इट डज नॉट इंक्लूड स्ट्रॉन्ग स्टेरॉइड्स. इट इज़ अ वेरी 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 लेस विद ऑलमोस्ट negligible side effects. Non-steroidal contraceptive which include a chemical called cetacromen. सेटाक्रोमेन, जिपमर का क्वेश्चन है बेटा, ये ऐसे ही क्वेश्चन पूछे जाते हैं जिपमर और एम्स में. सेटाक्रोमेन, इट इज इंक्लूड द केमिकल सेटाक्रोमेन. एंड प्रोजेस्ट्रॉन और एस्ट्रोजन पिल्स, always remember they are steroidal, and steroids definitely they have side effects, may have side effects on the body, may have, not exactly 100% that they will have side effects, they may have side effects. Saheli was developed by CDRI, which is called Central Drug and Research Institute, which is in Lucknow, right, India. So this is about your oral contraceptives. They are very very high contraceptive value, right? And Saheli, one thing about the Saheli is that it is non hormonal, because it includes the chemical that is tetrachromen, and it is non-steroidal, right? And it has very 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 few side effects, almost negligible side effects. And why it is preferred? Because it is taken only once a week pill. Otherwise other tablets, combination pills are usually you have to take daily basis, but Saheli, it is has to be taken only once a week in a during the menstrual cycle. Now the second last is injections and implants. Implants are very 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 thin structures, needle like devices which are implanted under the skin. Why these structures they are implanted? They either has progesterone, or they have combination, that is progesterone or estrogen, as well as they can be used as the injections also. And action is same, their effect is same as the pills, but definitely they are effective for a longer period. And if progesterone or या फिर combination or IUDs they are given, it is very very important information for all of you, which every one of you should know, that if any girl or any lady it has suffered from some unwanted coitus, unwanted sex or rape, then how you can prevent the pregnancy? If you give the combination pills or progesterone or any IUDs, they are given within the 72 hours period of time, then the pregnancy can be avoided. This is very very important information which every one of you should know, because you are dealing with the biology is very important part. So definitely these conditions, these type of information should be known to you. The last method is the last that is surgical methods. In surgical methods, two different processes are used. They are differently used for males and females. It is a surgical method. Procedure surgery is done by the doctors. In males, vas deferens is cut. As you can see here, this vas deferens, it is cut, and again it is not. नॉट बांध देते हैं उसको, लाइगेट बोलते हो जिसको आप. सो इट इज़ कट एंड लाइगेट, एंड दीज डेज इट इज़ सच अ फाइन प्रोसीजर विच इज़ डन दैट इफ़ ड्यू टू, यूजली ये तभी करते हैं जब फैमिली कंप्लीट हो जाती है, राइट. अदरवाइज डॉक्टर्स प्रेफर नहीं करते हैं इसको, या फिर देयर इज़ सम अनदर काइंड ऑफ कंडीशन. नाउ if still there is any kind of condition, so doctors they make sure that they can reverse it back, right. Usually it is not easy, that is that way it is not easy, but yes, sometimes this knot, in that case it is opened and ligated again. So but otherwise to prevent the pregnancy, what we doctors use कि ये जो vas deferens आपको दिख रही है, ये vas deferens को कट कर देते हैं, and then they tie a knot, they ligate it, right, separately. So this help to prevent the unwanted pregnancy. This procedure is known as vasectomy, right. फीमेल्स में, क्योंकि वास डिफरेंस फीमेल्स में तो होती नहीं है, फीमेल्स दे हैव दिस फेलोपियन ट्यूब. सो दिस फेलोपियन ट्यूब इज कट एंड this is tied at the different places, and this procedure is known as tubectomy. So these are the basically surgical methods. These are the surgical methods which are used to block the transport of gametes, and अगर gametes ही transport नहीं होंगे तो there will be no conception, there will be no pregnancy. Another method which is definitely not contraception, but sometime if there is any medical condition, if sometime there is any disease is there, then the doctors they remove testes and ovary in the females. Removal of testes is known as castration. This is testes, they are removed, they are dissected, or they are squeezed, and removal of ovary is known as oophorectomy. Right, it is known as oophorectomy, and removal of testes is known as castration. So this completes our first part of the chapter, in which we discussed about the different methods of contraception. We are left only with the medical termination of pregnancy, as well as the different infertility methods by which a couple can conceive the baby. That I will proceed in my next 2 lectures. Okay, till then all of you take care of yourself and keep studying with your full strength.